Hello, my name is Dr. Daniel Su, and I am an urologic oncologist. In this video, I'd like to introduce you to multiparametric MRI. This is a specialized MRI created for the detection of prostate cancer. I'd like to give you some basic clinical information for the procedure, its indication, and how to prepare for the study. So let's start with the basics. MRI is essentially a very large magnet that's rotating around one's body. The magnetic signature can create a picture within the body to look at different organs to obtain information about those organs. A multiparametric MRI is a more advanced form of this MRI specifically designed for the prostate. When the MRI is done, there are actually 4 sets of images that are taken simultaneously, which gives us a lot more information about the organ that we're looking at. When the magnets are turning on and off, what's actually happening is that the water molecules in your body is shifting from one end to another. When this is done thousands of times in 3 dimensions, we're able to see a clear picture of the organs that we're looking at. The prostate is actually a very dense organ that's hard to look into. In fact, ultrasounds and CT scans are unable to detect any prostate cancer. When the multiparametric MRI was invented, it was the first image that's able to look into the prostate and give fairly accurate descriptions of possible cancer cells. If you ever had a CT scan, MRI is very similar to this scan. However, there are some key differences. So let's go over what are the similarities and what are the differences. So MRI is typically performed at a radiology center or at a hospital, just like a CT scan. And this MRI, for the purpose of prostate cancer screening, also requires an intravenous line to be inserted. This intravenous line allows the radiologist to introduce dye, which will make the image a lot clearer. There are some major differences between MRI and the CT as well. Number one, the MRI is a tube instead of a donut. The tube shape allows the MRI to generate a strong magnetic signal to obtain clear images. And because the prostate is so hard to image, open MRI or wide bore MRI is usually not sufficient to look at the prostate. The other difference is that MRI is essentially a giant magnet, so we can't bring in any metallic objects such as your cell phone or jewelry into the MRI machine. Lastly, MRI can be very loud. The imaging center will provide you with hearing protection and music to allow the study to go by quicker. So why do we do an MRI before a prostate biopsy? I'm sure you've heard and maybe read about doing a prostate biopsy after elevated PSA is detected. So why are we doing this study before even obtaining tissue? Well, the MRI actually allows doctors to triage patients. What I mean is MRI allows us to determine which patients actually need a biopsy and which patients can be safely observed without undergoing an invasive procedure. Furthermore, the MRI images can allow us to perform a much more accurate biopsy. We have a technology that allows us to use the MRI and overlay it with a live ultrasound image so we can target areas that are suspicious. The end result is that if we do the MRI before a prostate biopsy, we're able to perform fewer unnecessary biopsies, and in the biopsy that we do perform, we're able to get a more accurate result. So what are the pitfalls and downsides of a prostate MRI? Well, not every technology is perfect, and we're still learning about prostate MRIs. From a practical point of view, the study can be uncomfortable. The machine can be loud, and the MRI machine is a tight space. Furthermore, the studies can be quite long. Some studies are up to 50 minutes. There are things we do at the imaging center, such as hearing protection, music, and sometimes even medications for anxiety that will help you get through the study. The last difficulty with MRI is that it's such a sensitive study, a proper bowel prep is required in order to get the best pictures possible. And your imaging center will give you instructions on how to obtain the best image and do the best bowel prep. So what information does the prostate MRI provide your doctors? Well, there are three major questions we can answer with the prostate MRI. The most important one is, do I need a biopsy? And if there is any abnormalities, what is the probability of finding cancer based on the MRI? And finally, and this may not be related to prostate cancer, the MRI is actually the most accurate tool we have to determine the size of the prostate. Furthermore, if there's any concern for cancer, the MRI actually allows us to perform a very accurate biopsy. It can serve as a GPS, which allows the urologist to place the biopsy exactly where it should be, where we can have the highest probability of finding the worst cancer. How do I prepare for prostate MRI? Well, the process is actually quite simple. There are two major components that we have to help you prepare for before the study can be done. The first is a safety screening test for any metallic objects, and the second is a proper bowel prep. Your imaging center will reach out to you for the screening process and to provide you with instructions on the proper bowel prep. Lastly, if you have trouble with tight spaces, please contact your doctor so we can make the process easier for you. Thank you for watching.